Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 4 of 4 videos for upper left back pain relief. In video 1 we worked on all the upper left back muscles. In video 2 we worked on the muscles on the front of your chest that can be yanking on that upper left back. Video 3 we did basically these muscles that can torque your shoulder blade and cause you to have pain in your upper left back. And lastly, here in video 4, we're going to do your neck, your lower neck, and your neck and shoulder intersection that can, again, be affecting that upper left back and potentially causing you pain. So basically what we're going to do is we're just going to feel into that neck tissue back here and notice if you have any really tender spots. And like for me right there, there's a little spot right there. I'm just going to do some press, pull, release that I cover on the techniques page. If you're on video 4, you probably already know that. But I'll do a little press, hold, move, press, hold, move. And again, we're not massaging the tissue. That doesn't tell your brain to let it go the same way that this does, either pressing and holding and making that tissue move, or pressing and pulling and releasing, kind of like you're working on this tissue like it's clay. So that upper neck spot, let go for me. Come down to my lower neck. Not too bad, but I'll do a little, just for example, a little press, pull, release, press, pull, release. Now again, you can press in with that other hand on those fingertips. Get a little more if I want to do that on my upper neck. It's amazing what that other hand, just adding a little bit of pressure, can do. It can make these techniques much more effective. Because you get just that little bit more pressure, still only as much as you can relax into, but you do that, and that's pretty good. And then we're going to come down to our, right that intersection of our neck and our back. Let's see if we do that. And basically just same thing, press, pull, release, press, pull, release, press, pull, release, press, hold, move. Notice anything that kind of makes that tissue move that feels like it's going to help you let go. Now in some ways it actually feels good, a lot of this stuff, believe it or not. You do that, and then if you want, you can come in here and just check on this top ridge here of your shoulder. You get a little bit of trap here. That's probably a little hard for us to get at with the tennis ball. So you kind of got to do that area, and you're just checking. This is the very top of that shoulder neck intersection there. Just want to make sure it's free. Now in me, my right side always gets tighter because I'm right side dominant, but you lefties out there, maybe that's who this video is for. Press, pull, release, press, hold, move. And then there's this little muscle here in the ridge of your top of your shoulder. Just check in there. It's called your Supraspinatus. Just make sure that's not too tight. It's not usually a big player in upper left back pain, but while you're here, release that. And then basically spend the time you need to release this whole neck. You can even check both sides of your neck, never hurts. If you're talented enough to just do both sides, that's good for you. If you're not, you can do one and then the other. Never hurts to make sure your whole neck is free. But now self-assess. What released? And did that do anything spectacular for my upper left back pain, or did it do even a little bit? And notice what was really tight and let go, and what was really tight and might need some more work. Because again, most of this stuff is just pressure and time. If you stick with it, I've been doing this forever, so I get that there's a bit of a learning curve. But press, pull, release, press, pull, release. You do this a little bit for a little while, and you'll have it down. And again, if you're at the computer too much, or you drive too much, or whatever, and you have your particular patterns down, you'll know that there's 2 or 3 things of all these things we did that really, really do it for you. And your upper left back is hurting. You go, well, let me just release this pec minor for a sec, and then your pain's gone. You can continue driving or computing without being in pain. So self-assess for step 4, self-assess for all the videos now. Go back, think about what you might want to do more of, remember what really worked. And I do sincerely hope that these videos were helpful, and thank you for your time.